Pregnancy is often described as a journey filled with hope. For countless women, it begins with the dream of nurturing new life, carrying a child close to the heart, and holding on to the promise of a future touched with joy. The simple image of a mother's hand resting gently on her belly reflects that tender moment of expectation when love begins long before birth. From the earliest days, an embryo starts to take shape. Within just a few weeks, small yet profound changes inside the womb decide whether a pregnancy will flourish. This is a fragile period, when growth relies on perfect balance. The beauty of life's earliest moments is also a reminder of how delicate they truly are. At the foundation of development are chromosomes, strands of DNA that carry the blueprint of life. When these instructions form as they should, they guide the body toward healthy growth. But when errors occur, survival becomes uncertain. Chromosomal abnormalities are the leading cause of miscarriage, responsible for most early pregnancy losses. Yet in many cases, the challenge lies within the blood itself. Conditions such as antiphospholipid syndrome can create clots in the mother's vessels. Though these clots may seem small, their consequences are severe, blocking the placenta from receiving vital oxygen and nutrients. Without this lifeline, pregnancy cannot continue. In some cases, clots enlarge, filling vessels and cutting off circulation completely. For mothers facing repeated miscarriages, doctors often test for blood clotting disorders as a key factor. Even elongated clots stretching through arteries can disrupt implantation and growth. This silent complication often stays hidden until medical testing uncovers the truth behind repeated losses. Throughout these challenges, doctors walk closely beside families. With empathy, they explain, investigate, and guide, helping parents understand that miscarriage is never their fault. While medicine searches for causes, emotional support remains equally vital. Hormonal imbalances can also interfere, disrupting the body's ability to sustain pregnancy. Hormones are the body's natural messengers, and when their signals are disturbed, a pregnancy may end too soon. Chronic health conditions such as diabetes and thyroid disease can also play a role. Left uncontrolled, they create environments the embryo struggles to survive. Careful monitoring of blood sugar and thyroid levels becomes essential for women hoping to conceive. Sometimes the structure of the uterus itself presents obstacles. A healthy womb is designed to shelter life, but fibroids or a septum can interfere, preventing growth. Infections may also interrupt pregnancy, while the immune system, meant to protect, may mistakenly attack instead. Couples enduring miscarriage face not only medical explanations but also profound grief. A couple holding hands in silence reflects the invisible weight of loss. The statistics are sobering. 1 in 4 known pregnancies ends in miscarriage. Behind that figure lie countless stories of sorrow, silence, and unanswered questions. For many women, miscarriage feels isolating. Sitting quietly by a window, they hold grief alone, asking why this happened to them. Yet medical care can bring clarity. Ultrasound scans provide insight into growth and health, revealing whether a pregnancy is progressing normally. Some women discover structural issues such as fibroids or uterine septum, which can often be treated. Others learn they have polycystic ovary syndrome, a frequent cause of hormonal imbalance that complicates conception. Lifestyle choices also influence risk. Smoking, alcohol, and obesity increase vulnerability, but with guidance, these risks can be reduced. Treatment often includes medication and management, restoring balance, and renewing hope for the future. Beyond medicine, support groups offer healing spaces where families can share experiences and understand they are not alone. Symbols of hope carry parents forward. A pair of baby shoes, an ultrasound image, or a positive pregnancy test become reminders that dreams of family still live on. For many, the journey continues and ends with the joy of holding a healthy child. The smiles of new parents affirm that hope after loss is real. Healing, however, is not only physical, it is emotional and spiritual as well. Therapy, counseling, and compassion help families process grief and rediscover strength. For some, remembrance becomes part of healing. Lighting a candle honors the little lives lost, affirming that love endures beyond pain. Though miscarriage is a heartbreaking chapter, it does not define the entire story. With medical care, emotional support, and unshaken faith, families move forward. And for many, brighter days do arrive, days filled with healing, renewal, and the gift of new life.
Your heart will thank you. Together, we can build a healthier America.